Assalamualaikum warahmatullahi wabarakatuh. Our topic for this video assignment is hand hygiene, PPE and glove dermatitis. My name is Syahadah binti Omar, metric number 1815522. We'll start the presentation with the explanation on hand hygiene. Hand hygiene refers to any action of hand cleansing that removes microorganisms on the hands. Hand hygiene is considered a simple yet effective way to prevent infections for reducing the risk of transmitting infection. Hand hygiene includes hand wash and also hand rub. Hand wash is washing hands with water and soap or a soap solution, either non-antimicrobial or antimicrobial, while hand rub is applying an alcohol-based hand rub to the surface of the hands, including liquids, gels and foams. We all know that microbes are everywhere, but without seeing them with our bare eyes, it's almost impossible to comprehend. Hence, the first photo shows bacteria that grew when a boy who had been playing outside pressed his hand onto a petri dish. It shows a variety of bacteria grows on the petri dish. The next photo shows the differences between unwashed and washed hand under the UV light. The photos showed how much a difference it makes to rinse your hand for 6 seconds or to rub them with soap and water for 30 seconds. Microorganisms that inhabit the human's body can fall into two categories, which are resident flora and transient flora. Resident flora or normal flora are harder to remove because they are more deeply attached to the skin. When they are disturbed through hand washing or antibiotic use, they usually re-establish themselves very quickly. These microbes do not typically harm the host, and some of the resident flora are beneficial by acting as the barrier of the skin and protect it from any new pathogenic microorganism. Next, transient flora are found on the outer layers of skin and are fairly easily removed by hand washing. They are the organisms most likely to result in hospital-acquired infections. So, why hand hygiene is very important? As we all know, hands are the main pathway of germ transmission. Therefore, hand hygiene is the most important measure to avoid the transmission of harmful germs. Hand washing or hand rub helps prevent spread of infectious disease. A number of infectious diseases can be spread from one person to another person by contaminated hands. These diseases include gastrointestinal infections such as salmonellosis and respiratory infections such as influenza colds and coronavirus. Lastly, hand wash or hand rub also can minimize the risk of healthcare-associated infections. Microorganisms can be transmitted by several ways, and one of them is transmission from patients to the hands of healthcare workers and lead to cross-transmission of nosocomial pathogens.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nabilah Husna binti Nazumi, metric number 1819636. I will explain about the personal protective equipment (PPE). According to Occupational Safety and Health Administration, personal protective equipment or PPE is equipment worn to reduce exposure to hazards that might result in serious occupational injuries or illness. The injuries and illness may be caused by chemical, radiological, physical, electrical, mechanical, and other occupational hazards. PPE is an important preventive measure in the workplace. Gloves, foot and eye protection, protective hearing equipment, for example earplugs or muffs, hard helmets, respirators, and complete bodysuits are examples of PPE. In hospitals and healthcare system, a variety of personal protective equipment is employed. The first is gloves, which provide protection to hand and should be worn when dealing with patients, when handling contaminated equipment, and when performing invasive procedure on patients such as surgery. Gloves are intended for single patient usage only and should be properly disposed before treating another patient. Second, disposable aprons or gowns are used during patient handling to protect uniforms and clothing from contamination by blood or bodily fluids. Aprons and gowns should not be worn in the ward on a regular basis and should be replaced between patient, and in some circumstances, it may need to be replaced between operations on the same patient. Third is face protection. Face protection aids in the protection of the mouth and nose during operations that may entail blood and bodily fluids splashes. It also prevents the spread of infectious diseases that are spread by droplets and air. The type of face protection to use is determined by the level of isolation necessary and the nature of patient interaction. Face protection include masks, goggles, and face shields.
Hi, Assalamualaikum. My name is Wan Ahmad Ammar bin Wan Muhammad Kamal with matric number 1810677. I will continue the presentation with the steps of donning and doffing of the PPE. The first step of donning of PPE is by performing a hand hygiene, whether using water and soap or alcohol rub. And then put on isolation gown to make sure all the clothes are covered. Next, wear the respiratory protection and ensure the mask that you wear fit well on your face, especially on the nose. And then wear the eye protection and followed by gloves. The gloves that you wear must cover the wrist of the gown here. And I have provided the picture here to easily understand what I have said. And if at any time you feel you have made an error, please use hand hygiene between any of the steps or wash any area that has been mistakenly exposed. For doffing of PPE, the first step is removing the gloves. Ensure the glove removal does not cause any additional contamination of the hands. And then remove the gown and fold it into a bundle. Be careful and don't touch the outer surface of the gown. Next is removing the eye protection, such as the face shield or goggle. Carefully remove face shield or the goggle by grabbing the strap and pulling upwards and away from head. Do not touch the front of the face shield or goggles. After that, remove the respiratory protection and followed by performing a proper hand hygiene. Also, here is the picture of doffing of PPE so it can easily be understood.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Adibah Diyanah binti Jalaluddin, matric number 1819388, and I will be discussing on gloves. Gloves are used in medical and laboratory setting to handle chemicals which the function is to provide protection of the hands from possible contamination and infections. Healthcare workers must know the proper way of handling gloves. Firstly, when donning, they should check for cuts, tears and discoloration, as that may be an indication of degradation and it should be disposed. The staff must know of the proper way to don them and minimizing skin contact as much as possible. In order to avoid cross-contamination, precaution steps should be taken in avoiding touching materials such as cell phones, clothes, face and eyes. When doffing, the staff must also properly remove them and minimizing contact with skin exposure. The most recommended way to handle this is by grasping the cuff and peeling the glove off the hand so that the glove is inside out before crumpling it, and repeating the process with the other gloves. After removal of glove, perform a 7-step hand washing technique as endorsed by WHO and Ministry of Health, which is to ensure hands are free from any contamination. There are two types of gloves, which are latex and nitrile. Latex gloves are made of natural rubber gloves that is manufactured by milky fluid produced by rubber trees. It is less chemical resistant and is cheaper than nitrile. It often used in occupational settings such as food handling and medical industry. However, it can cause allergic reaction due to powder coating in the gloves. There are two colors of nitrile gloves, which are blue and black. Nitrile gloves are made of synthetic rubber. Its characteristic includes good chemical resistance, resistant to petroleum solutions such as gasoline and kerosene, and also have a long shelf life due to its good puncture resistance. It is used as an alternative to people with latex allergy reaction because it is resistant to oil and fats in the body.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Ameera Izyan with metric number 181208. We'll be presenting about the gloves dermatitis, which covers the topic of the latex allergy. What is latex allergy? It is a condition where the body's immune system overreacts to certain kinds of proteins found in a natural rubber latex. This can be found in the things such as rubber gloves, condoms, and some medical devices. According to a study by National Institute for Occupational Safety and Health and Center for Disease Control in 1998, there is about 1% to 6% of general population are sensitized to latex. For healthcare workers, this reaction affects about 8% to 12%. The symptoms of latex allergy range from mild to severe symptoms. Individuals with mild symptoms may experience itching, skin redness, hives, or rash. Meanwhile, persons with severe symptoms may experience difficulty in breathing, scratchy throat, wheezing, and even a life-threatening symptoms that is anaphylaxis. Latex allergy can occur through direct contact, which involves touching latex-containing products. Other than that, people can get latex allergy through inhalation. Latex products, especially gloves, release latex particles, which become airborne when we breathe in. There are three types of immune response towards latex. The first type of reaction is known as type 1 hypersensitivity or immediate hypersensitivity. An individual will develop a reaction moderated by the development of IgE antibodies as response to specific proteins in latex. This will then cause mast cells and basophils to release histamine, leukotrienes, prostaglandins, and kinins, which lead to the mild symptoms. It can develop to severe respiratory symptoms such as scratchy throat and asthma. The second type of immune response is type 4 hypersensitivity or also known as delayed hypersensitivity. A T-cell dependent reaction occurs at the skin and is triggered by the chemicals used in latex production. Therefore, a person may experience redness, itching, and various skin lesions, and when exposed to repeatedly to latex, it will develop the type 1 hypersensitivity. Last but not least is the reaction known as irritant contact dermatitis and allergic contact dermatitis. For irritant contact dermatitis, it is a non-allergic localized inflammation of the skin which does not involve the reaction of immune system. It is typically caused by chemicals involved in the production of the latex production. Whereas for allergic contact dermatitis, it involves a process called sensitization where immune system able to form response after exposures to the same allergens. That is why the symptoms occur 24 to 48 hours after exposures. There are several ways on how to manage and prevent the adverse reactions to latex. This includes the introduction of screening tests for individuals susceptible to latex allergies, using the powder-free low-protein latex gloves and synthetic gloves, a frequent cleaning work areas contaminated with latex dust, changing the ventilation filters and vacuum bags, and having the knowledge of latex allergy symptoms. For the less severe reactions, antihistamines can be administered. A prompt treatment in the form of intramuscular or intravenous epinephrine can be applied for the life-threatening reactions such as anaphylactic shock. Last but not least, supportive treatments such as the administration of oxygen and monitoring of vital signs should also be supplied as needed. That's all from us. Thank you.